Okay, without further ado, let's move on to the next slide and let's begin. Okay, the agenda for this morning, for today is welcome and introductions. We will take a look at key insights into domestic resource mobilization for family planning in Asia. We will have some panel presentations, a panel discussion and Q&A, followed by closing. We're very excited to hold this webinar with a panel of 4 speakers who recently participated in the learning circles on domestic resource mobilization. Next slide, please. We have with us Tash, a resource mobilization coordinator at the YP Foundation in India. They work in resource mobilization, creating and implementing fundraising goals for the organization. We have Verhilde Claro, Policy and Health System Senior Advisor at RTI International Philippines, which strengthens and enhances access to essential maternal and newborn care. We have Saurav Neoji, Regional Program Manager at Jhpiego India, where he manages USAID-supported projects. We have with us Shivani Garg, Program Officer at Jhpiego India, who leads Udan Collaborative, a digital initiative that revolutionizes family planning and SRH services. They're extensively involved in resource mobilization in Asia, and we are very lucky to have them with us today to share their experiences in localizing efforts in resource mobilization and discussing the potential private sector engagement. We're also exploring best practices and lessons learned in domestic resource mobilizations approaches in the Asia region. Next slide, please. But first, let's take a look at a bit of housekeeping. We hope you've changed your name in the Zoom screen. You will be muted. So if you have any questions, if you have any issues, please engage in the chat box. We would love to hear from you. If you have any questions when the panelists are speaking, please go ahead and put them in the chat box. This webinar is also being recorded. So if you have any questions, again, don't worry. We will be sharing the link to this recording after it's over within a week. All right. Thank you very much. Next, I would like to hand over to Anne Ballard-Sara, our partnerships team lead on knowledge success. Thank you.
Thank you so much, Meena. Hi, everyone. Good evening and good morning. As Meena mentioned, I'm the partnerships team lead on the Knowledge Success Project, and I'm very excited to be joining you all today for this really important and timely topic of domestic resource mobilization. Next slide, please. Before we begin, I did want to start with a quick background on the Knowledge Success Project for those who might not be as familiar with the project. So we are a 6.5-year project funded by USAID's Office of Population and Reproductive Health. And the project is led by Johns Hopkins Center for Communication Programs in partnership with AMREF Health Africa, Busara Center for Health Economics, and FHI 360. Next slide. We support learning and we create opportunities for collaboration and knowledge exchange within the family planning and reproductive health community. So our overarching objective as a project is to ensure that people working in family planning and reproductive health can find, share, and use the knowledge that they need to transform the lives of women, men, couples, and families everywhere. Next slide. So I'd like to introduce you to our Asia regional team, including Meena and Pranab, who will both be facilitating today's session. Meena Aravanathan is the Knowledge Success Asia Regional KM Officer. You just met Meena. And Pranab Rajbandari is a Regional KM Advisor for the Knowledge Success Project, and they'll be taking us through the webinar today. We also have support from Brittany Getch, Sophie Weiner, and Aoife O'Connor on the Asia regional team. So during today's session, we have a wonderful panel of speakers who you all got a sneak peek of from Meena just before. They'll be discussing strategies, insights, lessons learned, and recommendations related to domestic resource mobilization. All of the speakers from today's webinar recently participated in the Learning Circles cohort on the topic of domestic resource mobilization in the Asia region. So before we dive into the insights that they'll share with you today, I also wanted to share some background regarding what Learning Circles is. So Learning Circles is a participatory peer-to-peer learning program for global health professionals to discuss and share what works and also what doesn't work in family planning programming and pressing implementation topics. So Learning Circles aims to improve global health professionals' replication and adaptation of best practices to avoid repeating past mistakes. And cohorts are made up usually of about 30 participants or fewer, and they usually meet virtually for 4 sessions over a month-long period. During those sessions or that period, they discuss frameworks for the specific technical global health topic. They explore what's currently working well, what their teams or projects could be doing better to improve global health outcomes regarding that topic. And then they leave the workshop with individual action plans that they'll carry forward in their work. Next slide, please. So through participating in a Learning Circle cohort, participants share and exchange practical solutions to pressing challenges with their peers. They network with others working in a very similar field within the region, and they learn various KM techniques to facilitate these types of discussions in the future. So that is an overview of what Learning Circles is. And now I'm going to hand it back to Mina, who's going to share some of the insights that came from the most recent cohort on domestic resource mobilization. So Mina, back over to you.
Thanks so much, Anne. Really appreciate it. So we are now going to take a look at some insights that we gleaned from our learning circles that Anne talked about just now. Next slide, please. The USAID defines domestic resource mobilization as the process through which countries raise and spend their own funds to provide for their people. And this is suggested as a long-term path to sustainable development finance. And indeed, if we were to use this for our context today, by stepping away from reliance on governmental or donor funding in localizing resource mobilization or fundraising, there are some distinct benefits that we can glean. One of it is that we can increase local buy-in and financial sustainability of family planning programs. It reduces the risk of interruption of family planning programs because by having multiple sources of funding, even if one funding source dissolves, there's always others to ensure continued programming. In short, resource mobilization refers to activities that secure new and additional funds for your organization and helps you also to make better use of existing funds and resources. Next slide, please. During our learning circles, we got to see many examples that were working, many successful ones, and also some of the challenges that many people had in resource mobilization. We identified 4 major ones that were across the board: supply chain disruption, advocacy, deprioritization of FP by governments, limited resources as well. So if we were to look at supply chain disruption, some of the advice and ways to overcome it was to advocate for more contraceptive choices from government, supplemental add-on from donors, and also in engaging local governments to discuss allocation schedules for funding. For advocacy, it was suggested that we needed to look at meaningful engagement beyond dollar signs, look at private sector engagement through CSR, and also public-private partnerships. With deprioritization of family planning by governments, many suggested evidence-based advocacy, and multi-pronged one at that, to sensitize stakeholders and not just stop with just one message, but many different messages going out at different times to different stakeholders. They also suggested considering the combination of issues and not just going in with one thing in mind, that is family planning. In terms of limited resources, many people said that they lacked the capacity to actually even raise funds. They lacked the capacity to do training. So for this, in maximizing what was already available, it was suggested that maybe they hold online or hybrid training or peer-to-peer learning, and even lobby for government facilities that were underutilized and use them for training sites. They also suggested self-learning with digital tools. In short, resource mobilization needs to be creative and interesting. And we have some very interesting sessions coming up for you now, and I will hand it over to Pranav. Thank you.
Thank you, Meena. So now we move on to our lightning talks. So we have 4 speakers, and each speaker will have a 3-minute time to present. So I'd like to request participants to ask questions in the chat for any speaker, and we'll have a Q&A session after all the speakers have presented. Next slide, please. Our first speaker is Tash. Tash is a resource mobilization coordinator at the YP Foundation. Tash is a trans queer feminist with a master's in women's studies. They're interested in issues of health equity, gender justice, and sexuality rights. YP Foundation India is a youth-led organization facilitating young people's right-based leadership. And specifically, Tash works in resource mobilization, creating and implementing fundraising goals for the organization. Welcome, Tash. The floor is yours.
Thank you, Pranav. I'd just like to start by saying how there are often protectionist and discriminatory attitude towards young people, which create lack of access to information, services, and rights. Stigma around young people's sexuality often creates gaps in research and evidence around realities of young people, which some often makes like fundraising slightly challenging at times. It would cost around 408 rupees per capita per year to fully meet the need of women in India for modern contraception, maternal and newborn healthcare, treatment of major curable STIs, according to adding it up by Good Master. The total budget of Ministry of Health and Family Welfare in India is around 87,656 crores. And the budget for family welfare schemes within it is around 694 crores. Within family planning, family is often seen as a heteronormative marital union of a man and a woman. We at the YP Foundation aim to incorporate ideals of justice, sexual and bodily autonomy, and reproductive rights. Often, domestic fundraising can include collaboration with philanthropies and CSRs. Some challenges of working with CSR has been to find alignment with provision of tangible one-off solutions to sexual and reproductive health and rights for young people in a meaningful way while maintaining a feminist, intersectional, and rights-based approach. There might also be more possibilities that can be realized via domestic funding as compared to perhaps foreign funding. Some examples of this can include sub-granting or doing advocacy work. The Foreign Contribution Regulation Act, or FCR in India, ensures transparency, accountability, and legal adherence, but also increases the scrutiny of work of some NGOs. For instance, what we now term as policy engagement or increased engagement with the government might perhaps 10 years ago be called advocacy. For instance, through our policy engagement program, which works with different policies in India, like, for instance, the Rashtriya Kishore Swasthya Karyakram, or RKSK, we see that it recognizes the need to address lack of information on contraception through school and community program. It focuses a lot on contraception, but perhaps not enough on comprehensive sexuality education. So issues like premarital sex, condom, contraceptive use are perhaps not focused on. We're hoping to work towards building capacities of RKSK functionaries.
Yes, you have 30 seconds left.
One strategy to do this is, instead of collaborating directly with the funders, we also tend to build ties with private organizations that work with the government. For instance, we've recently conducted some state level conferences and are now culminating it into a national level conference. I also want to perhaps end by saying something that I actually learned in one of the learning circles, which was a framework of almost looking at funding strategies in family planning in India, which includes doing stakeholder analysis, which includes identification of public and private stakeholders, doing advocacy for increased resource mobilization in fundraising, to develop key asks or messages that sort of set you apart, and to go on to then develop a resource mobilization strategy. Thank you.
Thank you, Tash. Thank you so much. So let's move on to our next speaker. So Virgil is a policy and health systems specialist with 20 years of experience in public health policy, supporting the implementation of universal healthcare reforms at the national and subnational level, with a focus on health financing, strategic purchasing, primary care governance, and health system strengthening. He currently works with the USAID's Reach Health project as a senior advisor, policy and health systems. Welcome, Virgil. The floor is yours.
Thank you, Pranav. A pleasant morning, evening to everyone. Thank you for joining us today. I'm very honored to share our experiences in domestic resource mobilization for family planning in the Philippines. Just to give you a bit of a context, our country, like many others, grapple with inadequate funding for essential health services, including family planning. And this actually led to a number of disparities in access and quality of care, particularly affecting marginalized communities. However, in the last decade, a pivotal shift occurred with the enactment of two landmark legislations. These are the Responsible Parenthood and Reproductive Health Law in 2012 and the Universal Healthcare Law in 2019. These law prioritize universal access to family planning and sexual and reproductive health, as well as strengthen financing for primary care, respectively. Recognizing the potential of social insurance as a domestic resource, our works, which spanned 6 years, focused on integrating family planning into primary care. The Philippine social insurance system, we call it PhilHealth, is the largest healthcare purchaser, and these health insurance offered a strategic opportunity for family planning. Through advocacy and policy development, we achieved several milestones. We're able to expand primary care coverage, starting off with family planning counseling, which was initially included, and this was followed by broader services like adolescent care, maternal and child nutrition, and breast cancer screening more recently. With the expansion in the primary care coverage, we're also able to secure a significant increase in social insurance payments for family planning, projected to reach to about like $200 million within the year. We have also improved access by eliminating co-payments in public facilities and introduction of fixed co-payments in private facilities, and this enhances affordability and accessibility of family planning services for everyone. Our efforts have actually yielded tangible results. The increased social insurance payments contributed to a projected 0.8 increase in the share of social insurance to current health expenditure in the country. Expanded access has also empowered marginalized communities, reducing financial barriers to essential care.
Virgil, you have 30 seconds left.
And to sustain and expand these gains, we must continue advocating for increased investments in primary care and family planning facilities at the local level, ensuring their readiness to access public financing from social insurance, as well as strengthening local government capacities to align social health insurance reimbursement with public financial management processes, including planning, budgeting, and procurement for long-term sustainability of family planning service provision. That's a brief overview of the resource mobilization work we did on this side of the world, and I hope that our experience and approach can serve as a catalyst for similar initiatives in your own countries. I invite you to explore how these strategies can also be adapted and tailored to your respective context. Thank you for your attention.
Thank you, Virgil. Thank you so much for this interesting presentation. So let's move on to our next speaker. Up next, we have Saurabh from Jhpiego, India. Saurabh is a seasoned public health professional with over 16 years of experience in research and implementation, and has been instrumental in various roles, including regional program manager at Jhpiego, where he has managed USS-supported projects, and state innovation officer for the Norway-India Partnership Project. His work spans multiple states in India and is focusing on gender-based violence, family planning, and adolescent health. Welcome, Saurabh. The floor is yours.
Thank you, Pranav. Good evening, everyone from India. So let me, without wasting, I think in both the cases, you have the presenters talked about more global experience and national experiences. Here in my context, I'm going to be more specific in the interventions that we tried and tested in a very remote corner in India. and how we have mobilized resources by engaging the corporate. So this is quickly, we work in a state of Assam, which is in northeast of India. And if people are aware of it, it's one of the remotest corner of the country. Hence, the access to services are limited. And we work with the Tea tribe community, which is, again, a very secluded community where access is very limited. So we started engaging with the tea industry, which basically employ this tea tribe community. But however, given that it's a for-profit organization, they're interested obviously for profit maximization. All the social schemes are part of they're expected to do. However, it's always limited. So the advocacy, when we started talking with the corporates to include family planning in a more robust manner by expanding the contraceptive choices, our narrative was more not from family planning, is more as a workplace intervention rather than a family planning project. By saying that by provision of family planning options, for the Tea tribe workforce, you will have a more productive workforce. You will have less absenteeism because of unwanted pregnancy. So it's very important, again, coming back to the point that what is the narrative that we are making? Even in today's context, when it comes to family planning, I think the narrative should be contraceptive choices as a more lifestyle choices rather than talking about family planning. So the narrative and the audience is very important. And from that perspective, if you align your advocacy goals, then it will eventually bear fruit in a longer run. So because of our continuous advocacy with the tea industry, and we able to demonstrate in a small pilot in one of the districts in the state, we able to garner a lot of confidence from the industry itself, and we able to expand the project across the state of Assam in many tea gardens in a very short span of time of 1.5 years. And actually, we are taking this project forward with the Tea Industry Association as well in the coming months.
Sorry, we have 30 seconds.
Yeah, sure. And how we are doing it is we are taking the industry with whom we have worked so far as a torchbearer for our project. So that's how we gone about this project, and we got a lot of support from not only from the tea industry now, but also the tea fraternity and tea tribe community for introducing this family planning project, but not as a family planning project, but rather a workplace intervention. Thank you.
Great. Thank you, sir. That was in time. Thank you for the interesting presentation. Now let's move on to our next speaker. We're going through a lightning round, so we're quickly moving through. Our next speaker is Shivani Garg. Shivani works with Jhpiego as a program officer in India. She has a BTech in biotechnology. She's a master's in public health, and she is involved in digital initiative revolutionizing SRH and family planning for India's young population. And an interesting part about her past experience is when she was in undergrad years, she was recognized for a project in generating electricity from cow urine. So very interesting. Shivani, the floor is yours.
Yeah. Thank you, Pranav. Hi, good morning, good evening, everyone. So we have been hearing about why domestic resource mobilization is important in terms of creating sustainability and effectiveness when we talk about SRH and family planning. And in that area, I would say private sector engagement is one of the integral part to bring in the resource mobilization altogether. And the initiatives like Udan Collaborative, where we are bringing various private sector stakeholders all together at the one platform to improve SRH and family planning services among the young people, is one step forward towards bringing domestic resources at one platform. So this is an online platform which is available, where we are partnering with various private sector healthcare providers, including pharmacies, gynecologists, and general practitioners, who will be providing youth-friendly services to the young people. This Udan platform is like a marketplace which will be enhancing the accessibility and affordability of SRH and family planning services, as well as the products in the market. There is a huge media campaign and huge on-ground activation, which we are working on in order to create the buzz about Udan Collaborative across the country and to reach out to the maximum number of audience among the young individuals. Now, the challenges that we faced during the implementation of this project in the field was the engagement from the private sector, including the healthcare providers and the corporates, and as well as in order to capacitate and do the skill building of these healthcare providers on how they should provide youth-friendly services, what type of modules should be out there, what exact information needs to be out there, as well as in order to capture the interest of the corporates in the current market demand when we talk about SRH and family planning, and how we can look for the investments and resource allocations from the CSRs, especially for the young people in the domain of SRH and family planning. The current impact is that this platform is live. We have created a network of over 10,000 healthcare providers on the platform. There are doctors, there are pharmacies in all the areas. We have expanded our network in 12 states and in 25 cities of India, and now we are expanding more. We have partnered with various private sector, social enterprises and corporates on the partners. Their products are also available that can be, and this platform is providing them more
Shivani, you have 30
engagement
seconds.
and branding, more engagement, as well as more market visibility among the young people. Now, in the coming time, in order to create a sustainable model, we are also working towards the business model, where we are currently working on various revenue streams in order to create the sustainable model for Udan Collaborative. There is a whole media campaign that will be out there, where we will be having 2 films shot launched through YouTube. So we shall be reaching out to the various young individuals through YouTube, through Instagram, and other channels, depending upon the local consumption in the states. And there will be the engagement among the youth from the colleges, from the hangout points, and all.
Thank you,
Yes.
Shivani. Thank you.
Thank you.
A very interesting round of lightning talks from our speakers. You'll have a chance to ask them questions through chat. So I hope you're doing that. Thank you again to the speakers for your interesting presentation. Back over to you, Meena.
Thanks so much, Pranab. Really interesting session. Thank you, panelists, for sharing the important work that you do. And I can see that many of you have had challenges in securing funding for FPSRH, and what you're sharing is insightful, although we apologize for the short nature of it. So anyone who has any questions, please feel free to type it into the chat box and we will attend to it. Before we move on to I think that's a question for Tash, but before that, if it's all right, may I ask Shivani a question here? You mentioned that a big challenge was getting public sector engagement and healthcare providers on board. But what came first? Did you have to put in your own funding, or were you able to connect with a private sector organization and then get started on Udan, if you don't mind?
So the funding is from the USAID. We got the seed funding from USAID India to pilot this initiative, to create the architecture of the website, as well as to initiate the field work for reaching out. Now, as we have completed the first phase of Udan Collaborative, where we have established the network, where we have developed the architecture of the website and have onboarded the healthcare providers, as well as few of the interested corporates. Now we are currently working towards corporate engagement and private sector engagement, where we are reaching out to various corporate, social enterprises, CSRs, in order to look for the investments, as well as to look for the opportunities on how we can partner and collaborate with them for exchanging the services.
Well, 10,000 providers already there. That sounds really exciting. Wishing you all the best with that. Maybe we'll come back with more questions for you, but for now, there's a question for Tash. Could you expand a little bit on what exactly corporate social responsibility consists of? And why would corporations be interested in this?
I think it's legally mandated in India for corporates who earn an income of a certain bracket to sort of give back to the community. It's a way in which corporates can sort of come together to create a society which tries to just do better. And corporate social responsibility is essentially corporates funding NGOs or using the resources to even, for example, create public parks, benches, or sort of engage in any activity that can help and move towards public good. So one strategy for NGOs could be in fundraising to reach out to corporates through CSR.
Okay. So if I can just ask a follow-up question to you. You say that you have ties in working with private sector who work with government. Has it been a CSR approach or have you tried something else?
This has been something else. It's usually been like collectives. It's been through collectives, through networks, through other NGOs as well who've been working closely with the government. And that's just been a way to sort of scale our work.
Okay, great. Thank you. So if I may approach Verhil now, if I can ask you this question, what would it take to replicate your success elsewhere? I mean, you mentioned that you had advocacy and policy development, and I think a big part of it was UHC. So if you could maybe give us a little bit of an idea of how to replicate the success, that'd be great.
Very interesting question, Mina. No, I think I would say you have to link it to broader development goals and national priorities. I think UHC, in many countries has been a huge priority, within the region and across nations. So if you have these sort of like similar policy and legal frameworks that are available, it would be actually good to show how specific programs can actually fulfill the objectives of these broader national priorities. I think that's an important aspect of ensuring that there is adequate buy-in for both the national and the local governments on that space. But I think more than that, it's very important to map out really available domestic resources. For instance, if you have these broader development goals and national priorities, most probably there are actually available resources to fund those. And it's just a matter of you really finding some ways to be able to dip into those resources that are made available for these type of priorities. So I think that will be my first and front-facing activity that I need to do in order to push for specific agenda within the national health priorities.
Well, thank you very much. Congratulations on your success. If I may ask Saurav a question before we move on to the next question. Saurav, so you work with the Tea tribe communities, and like you say, they're very isolated. If I may ask, you spoke of meaningful engagement before in our learning circle, and I was just wondering, how long did it take you to reach an understanding with the tea garden authorities, and what was your key message here?
Yes, I think so. We had actually 7 to 8 rounds of meeting before we were able to finalize this program with the tea companies, and it's very key, which I have mentioned in my presentation as well, that while discussing about the project, we realized that they give it a lot of importance in terms of healthy workforce. No matter they want profitability, but they also want, because it's the season in which the tea tribe works, if during that time if they fall sick, so they put a lot of stress on the absenteeism. So when they provide health services for the tea tribe community, they put a lot of stress on absenteeism. So their yardstick of measuring how the healthcare is good is by saying that if they can reduce absenteeism due to health illnesses. So if the suppose some services are there in the tea tribe hospitals or tea garden hospitals, and they're unable to reduce absenteeism even after providing health services, that's how the health services are measured. So absenteeism is one of the key criteria. And often what we have seen, there are other definitely diseases for which people do fall sick. So it's a narrative. Then we understand that because of the isolation, because of lack of family planning choices and options, in terms of maternal mortality is very high in those districts, along with unwanted pregnancy is very high among the population. And we link it immediately, saying that even that leads to absenteeism, and you will not have a productive workforce for a longer duration. If let's say if someone is having a fever, they might be fall sick for 10 days, but if unwanted pregnancy may lead to more a number of days absenteeism. So that's the starting point when they were able to align with the project objective. Yes, that the option for family planning is important, and that too also the importance of LARC method. So we stressed on the LARC, long-acting reversible contraceptive, rather than the short-acting one, which are already there, the normal ones. And so it's a continuous process. I strongly feel that aligning objectives with the organization. Let's say if tomorrow we go to a for-profit organization, Norway linked with FPSRH, how do you link them? So then the linkage will be, it's more sort of a workplace intervention. And if they have a youth workforce, it's very important that often they have corporate social responsibilities, and if an youth has not, given the challenges now they are facing in terms of access to information, and Tash has also talked about sexuality education, often that is lacking throughout the generation. So even through a workplace intervention, FPSRH can be integrated with any organization. So it's the pitch, it's the narrative that's very important for success, rather than just going with a very straight-jacketed approach that you talk about family planning and health. Yeah.
Great. Actually, so you found a workaround. It's like an out-of-box thinking thing. Yeah, very creative. Thank you. So now we have a question for Shivani from Sam. Engaging private sectors in an attempt to increase access to family planning for young people is not an easy task. So Sam's question is, how was the engagement? Do you see sustainability?
Yeah, right. So engagement with the private sector, including both the corporates and the healthcare provider, was not easy. Hence, there has been the continuous work that has been out there, where we have collected various feedbacks from the young, first of all, from the young individual, what is their exact needs in terms of accessing the right information as well as the products out in the market, and then looking out for the right private sector players who are working in this area or would like to invest or would like to get more engagement with the young people, was one of the tasks that we followed. And then there has been the continuous engagement with the providers, where we have developed few modules, and where we showed them how this initiative, which is working in order to create an environment for providing these services, can be beneficial for them also, in terms of visibility, in terms of more footfall in their clinics as well as on the shops, and in terms of more getting more money in terms of selling their products out in the market.
Great. Thank you, Shivani. So I think that tells us a lot. It's about not what's in it for us as FP professionals, but also what's in it for them that you need to pay attention to. Thanks, Shivani. So we have a question, an open question from Muhammad Tariq. Hi, Tariq. It's good to see you again. He's from our learning circle too. Has there been any kind of sustainable plan engaging with the local community and government? Has there been a sustainable plan engaging with local community and government? Anyone wants to tackle this question?
Hi, Meena. Yeah, I can do that quickly. Again, so let me quickly talk about again the project context. So FPLMI's Family Planning Logistic Management Information System is a family planning logistic management system which runs in India, and often even private clinics do have access to that process. I'm saying they can always register, and they get a free contraceptive supplies from the government itself through FPLMIs, the basic supplies. So how we have done it, even in the tea garden hospitals, we ensured that the regular supplies from the government, it should be available for them as well. So linking government services is very critical. I'm saying even if it's a private and they don't have the resources, or if it's an NGO which runs a hospital or a charitable, they can still have access to the government supplies which are regular in nature. And so understanding the system and how to integrate is very critical. So that's how even we tried in Assam, where we linked all the tea garden hospital with the FPLMIs, and through which we ensured that at least the regular supplies, condoms, contraceptives, oral pills, and injectables are readily available. And we also oriented the states, because we do give technical support to the state as well on certain aspects. So we actually even had a discussion with the state in terms of if there are contraceptive disruptions are there. And we link it with the district authorities as well, because often these are not managed at the state level rather than at the district level. So what I'm trying to say is intervening at the right place is very critical. So you need to understand the ecosystem in which you're working, who are the suppliers, and then you engage with the right authority, often bear the right presence. Yeah.
I'm hearing this message actually from everyone. It's like you got to think about the stakeholders, the audience, and then who are the people who you have to be cognizant of in terms of reaching out. It's not just private sector, but also government, local government, to make sure the supply is also there. And in a way, it's kind of all fitting into a jigsaw puzzle type of thing. Yeah. Great, thank you. Actually, Saurav, there's another question for you, if you don't mind. How was the engagement to gain a buy-in from the tea plantations? This is from Sam Labu.
Yeah, hi, Sam. Yeah, thanks for the question. I think it's a long process, very frankly. And in the first go itself, we had to demonstrate, as Shivani was also saying, it's a donor funded. So it's a USAID funded project. So initially we demonstrated in a very small geography that this is doable, that by introduction of contraceptives, the overall uptake of the family planning, by introducing newer contraceptive methods, the overall uptake of the contraceptive CPR overall in the tea community has improved. So we demonstrated, and we also shown that over a period of time, how even the absenteeism, which was the primary criteria, we're not able to capture it fully, because obviously absenteeism can happen to various reasons, but we're able to demonstrate, at least in the places in the season in which at least those who is availing the contraceptives, their absenteeism because of these reasons are lower. I'm saying because we cannot, our universe is limited. At least our universe is those who opted for contraceptive choices, rather than, I'm saying there are definitely other population as well, which also gone for absenteeism. So we restricted our universe for the study, and we demonstrated. And later on, they themselves have realized that, yes, it is important, and we able to scale up. And now our intervention is very limited. So initially, we had a lot of manpower, resources when we started doing the pilot, but we always kept the sustainability and scaling up of the model in the very beginning. So we started doing it. There are a couple of strategic shifts that we have done. I can just cite another example, how the strategic shift that we have done, and which reduced the cost and it ensured that more sustainable. So we initially, when it comes to engaging the community, we hired local manpower who go door to door and talk about contraceptive, the importance of contraceptive choices. And that we realize it's a very resource intensive process. And obviously once the funding support won't be there, it will not be sustainable. So how we have integrated, so during the ANC antenatal checkups, so the hospital organize ANC days. So for anyone who is coming for the ANC checkups, we ensure that they provide family planning counseling during those sessions itself. And at the postpartum family planning, that's a very important component. So that's how, so from the community base, we make it facility-based awareness generation more common. So that's how we reduce.
Thanks so much.
That's one of
Thanks so much, Saurav. Thank you. So I'm going to ask a question to Rahil now. Did you have a resource mobilization strategy in place when you started? You said you started 6 years ago.
Well, what we actually did is to map out really the available resources at the national and local level. No? As I've mentioned, we have these really important legislations in place, and we wanted to be able to anchor on those legislations. So as I've mentioned, this legislation, if it's a national priority, always comes with it resources that are made available by the government. So I would say, you know, that we started off with that really a strong start. No, it's a positive start for us, but also we had to understand that what resources are available at the local level. Because here in the Philippines, the context is we are a highly decentralized country. So most of the resources are actually at the local level. So what we did is to made ourselves familiar with to familiarize ourselves with the local public financing management processes within the local government units, and identifying available resources from their end, no? And in order for us to be able to advocate for the inclusion of family planning into their local investment plans, we have to be able to show compelling data and evidence, including providing disparities, so information disparities in access, unmet needs, health and economic impact of providing inadequate services. And along that support is we provide also capacity building support to the local government staff in order for them to be able to effectively use this data for decision making and making in developing costed implementation plans. So actually we have to sort of like look at existing structures and competence within the local government units in order for us to do that.
Thanks so much, Vahil. Tash, my question is to you next. You have mentioned that it's a challenging landscape. How have you been able to leverage on opportunities? Because sometimes you can't always get the kind of funding you want. You can't reach diverse groups. How do you do this?
So oftentimes, I think one way to go about it is diversifying how we're doing fundraising and not just relying on one source. For instance, we were conducting a community-based program in Delhi, and there was a demolition that happened, which left a lot of adolescent girls out of schools, in need of homes and a place to stay, and really affected their lives. And what we done after that, just after that, was applied for urgent funds to like big funding organizations, but at the same time using our social media, conducted campaigns where we raised around 2 lakh rupees online. So I think just being open to different ideas, especially given the risks that one can take in program implementation, has helped us. Oftentimes, whenever we try to build relationship with funders, and what we've noticed also is often it's the organization that you're pitching, and the work you try to fit in different areas. But if there's a buy-in with the organization and like broader thematics, there is a potential to come to an understanding and agreement on the different strategies that can be used for moving towards a common goal that has been decided. There have also been times where we've been recommended from funders have recommended us to each other, or which has been really helpful actually, and almost always leads to a successful campaign when we've been recommended by one funder to another. So I think maintaining good relationships, trying to do the work that you've promised, becomes some way into which you try to build trust.
Thanks so much, Tash. So what you're saying is relationships are definitely important and making sure you build that trust. Also, Virgil mentioned about making sure we have the evidence in place as well, right? So do you have any thoughts about that? Do you capture a lot of evidence as you work?
Absolutely. I think there's so many questions on impact that you get asked as an NGO. And oftentimes when the focus is there on learning, on implementing or doing, that can take a back seat. But I almost see like fundraising and monitoring and evaluation go hand in hand. And you try to build that in the culture of the organization, where sort of everyone's involved within these activities. Yeah.
Great. Thank you. Thank you so much. I could go on asking more questions of all of you. You have so much to share and so many interesting insights as well. Unfortunately, we are reaching the end of our session already. The hour is almost up. So thank you very much, Tash. Thank you, Virgil, Saurav, and Shivani. It's been a pleasure listening to you share your experiences. I'd like to thank the participants for sharing all their questions too. if we could move on to the next slide, please. The next slide, please. So reaching the end, and we would like to say, in terms of next steps, please stay connected. Do sign up for our email and newsletter. Do look for resources on FP and FPRH in the FP Insight community. I will share a link shortly. We have a webinar coming up on September 5th. If you would like to join us, we would love to see you. It's going to be on SRH in humanitarian settings. Next slide, please. So this is our FP Insight collection, resources on domestic resource mobilization, compiled by many people who joined the learning circles and also by some of us in the team. Please feel free to join FP Insight and add links and resources if you have anything that you would like to share with us as well. This is the resource page that you should go to. Next slide, please. So if you're wondering how to get there, we have the Knowledge Success link, the FP Insight Domestic Resource Mobilization Collection as well. And we also have links from UDAN, RTI, USAID, Momentum, and YP Foundation. So with that, I think we have one more thing that we would love for you to do. Thank you so much for being such a captive audience. If it's all right, please do fill out a survey. A survey always helps us improve. If you give us your feedback, we'll be able to improve ourselves as well. Thank you so much. And I would like to say thank you to the facilitation team, Brittany, Sophie, and Pranab, who helped with the presentation of the webinar. So thank you very much. I would also definitely like to say again, thanks Tash, thanks Verhil, thanks Shivani and Saurabh. Pleasure having you all here. Thank you.